medicine, addiction is considered a brain disorder, and recent years have seen significant advancements in various research areas. Specifically, Dr. George Koob from the National Institute on Alcohol Abuse and Alcoholism in the United States has mentioned that many candidates for addiction treatment drugs are being examined, targeting a negative emotional state known as hyperkatifia. However, there are problems with viewing addiction strictly as a brain disorder. Reasons include, firstly, recovery occurs within a social context. Secondly, studies suggest that people who have successfully recovered over the long term have a higher quality of life after recovery than the typical general population, or are in a state better than well. Thirdly, an approach that focuses solely on brain disorders can lead to excessive paternalism, undermining individual autonomy. Lastly, the brain disorder model fails to adequately explain spontaneous recovery. There may be some common elements among treatment approaches that have been scientifically shown to be effective. It may be that they are designed to increase the factors that are important for a person to live a healthy life. Rather than disease-responsive approaches, these strengths and resources of the person for recovery may change in ways that are unintended by the therapist and can lead to the patient's spontaneous recovery from addiction. The term recovery capital was first used to discuss the concept of natural recovery from addiction. Recovery capital is defined as the sum of a person's resources that can result in cessation and maintenance of substance use. Recovery is not achieved by the complete elimination of emotional and mental problems, but rather by the accumulation of the factors necessary for recovery, including increased strength, which is thought to overcome barriers to recovery. This concept of recovery capital will receive more attention in the future as a way